The information and opinions expressed by the guests or host of Health Thyself do not necessarily reflect the views of WBFY Community Radio or its license holder, the City of Belfast, or should be taken as medical advice or a health provider-patient relationship. WBFY Belfast Community Radio presents Health Thyself, a show about health and well-being. I now present Dr. Michael Housman.
Hello, this is Dr. Mike, and this is Health Thyself, a show about health and wellness. And today I decided that we're going to have a little bit of a discussion and explore the whole topic of inflammation in the body. It's something that I think we see quite a bit in my practice, and it would be good to talk a little bit about it, talk about some of the ways that it relates to dis-ease in the body and health and healing. Oftentimes we think of inflammation sort of as a bad thing and something we want to avoid, but it's actually a process in the body that's very important in terms of healing and in terms of maintaining the body. And there's always sort of a balance between the body working in balance and an inflammatory process where there's tissue that's breaking down or infection that's causing an inflammatory response. So I wanted to talk a little bit about sort of the physiology of how inflammation works and what it's for, and then talk about some of the different problems that can occur when inflammation gets out of hand and starts to take over systemically. So the inflammation response in the body is actually a response that happens when tissue or an infection enters the body, or there's an injury, like an injury to a tendon or a muscle. And this inflammatory response basically has certain properties to it. One of the properties often is swelling. Oftentimes if we end up spraining our ankle or spraining our knee or wrist, one of the first things we notice is that it starts to swell. And the reason this happens is that when tissue is damaged, the blood vessels start to leak fluid into the tissue outside of the blood vessels. And the blood vessels actually become more porous so that the white blood cells can actually exit from the blood into the tissue to deal with infection, bacteria, or wound, or some sort of injury. There's also chemicals that end up being released when there's an injury, and we know some of them are, there's actually quite a few, but the more common ones are histamine and cytokines, which are chemicals that cause pain, and prostaglandins and different chemicals that actually leak into the fluid, and this causes some of that swelling. And part of the reason for the swelling is to protect the area. When we have swelling, it not only is happening because the tissue is damaged and fluid is leaking into the tissue, but it actually serves to actually protect the area as well from further damage. It almost it sort of like makes a splint around it, and oftentimes the injury will tighten up and have spasm around it to protect it from further injury. So swelling is one of the properties. Also, heat is another property that happens with inflammation. If our body gets inflamed, even a systemic inflammation, where the hands might swell or the knees swell or the ankles swell, and oftentimes there's heat that's being given off, and it's because there's more activity going on in that area, and that generates more heat. There's more metabolic processes that are going on as well, and then the pain often that we feel with an injury like that kind of brings our attention to it. Pain happens for a number of reasons. One of them is because as the tissue swells, it puts pressure on the nerves that are around the tissue. And also certain chemicals called cytokines get released into the tissue, which trigger the nerve endings. And part of this response is to help make us aware that we do have an injury. If we didn't have pain and discomfort, the injury or an area that is in need of care, we may continue to injure it or make it worse. There's some diseases where a person doesn't feel pain, like leprosy and other diseases where there's numbness, and that can create more problems because then we're not aware of when we're injuring the area or making it worse. So inflammation, it actually occurs when the body also is defending itself against an infection. If we contract an infection either through our skin or through our lungs or through some avenue that it enters into the body, body has an inflammatory response as well. And again, this inflammatory response is also part of our immune system. Our immune system is designed in such a way that it rallies to fight the infection or to deal with the injury by responding to it. And this is, for the most part, a good thing. We want to have a strong, healthy immune system. We'll talk a little later about how to feed that immune system so it's strong. But that immune response that happens along with the inflammatory response is where the white blood cells called macrophages will enter the area, and those macrophages, or white blood cells, will actually attack and digest the infection if it's a bacterial infection, or they'll actually work to clean up if there's tissue damage. They'll actually work to digest and clean up areas where there's tissue damage or cells that have died. They come in there. So we want to have those healthy white blood cells working. And those macrophages, you can actually watch under the microscope. They go around the body and they're able to detect cells that are unhealthy or bacteria or foreign bodies in the blood. And they actually surround those foreign bodies, and then there's enzymes within the white blood cells that actually rupture and then digest either the foreign body if it's a bacterium or if there's tissue damage. They'll actually clean up that area. So, in a normal, healthy, balanced body, that immune response is very important because we're constantly taking in bacteria, either through our skin from cuts or from being inhaled through our lungs or taken in through our sinuses, or sometimes we'll have bacteria enter our body through our digestive system as well. And so we have these cells in our immune system which respond to the inflammation, whether it be from an injury or as a result of some sort of infection. So, inflammation for the most part is a good thing because we want the body to respond to injuries. We want it to respond to infection. The problem is when a inflammatory response becomes what's called systemic. And what that means is that the inflammatory response is ongoing. It continues in the body. There's a lot of research now that is pointing to heart disease and other diseases like diabetes and even arthritic problems as really being an inflammatory disease where this inflammatory response becomes ongoing. It continues. And so the individual might have joints that are continuing to swell, or they may have edema in their legs, or they may feel like their body is too hot, or there's various symptoms that can occur when somebody has inflammation that's ongoing. And it's thought now that heart disease is really an ongoing inflammatory condition where the arteries in the heart and throughout the body can get inflamed, and that may lead to the development of cholesterol plaque adhering to the arteries. It used to be thought that it was really just a problem with certain substances like cholesterol and low density lipids, LDLs, being present. So there was a lot of energy, or there is a lot of energy still being put into trying to get people's cholesterol levels down and getting their LDLs down and their HDLs up. But it appears, at least in my opinion, from the research I've read and also from my experience, that it's the inflammatory condition that leads to and works in conjunction with high cholesterol and other factors to make that cholesterol start to adhere to the arteries. Cholesterol is a substance that's actually used to repair arteries and repair the little nicks that happen, to our arterial system. But if a person is chronically inflamed, it's very possible, and I think we're going to find this more so as the research continues to develop, that that the adherence of the cholesterol to the arteries is what's causing the plaque formation and building up blockages in the arteries. And I think it's important that we understand what feeds the immune system in terms of making it healthy, and also what decreases inflammation so it does not become a systemic problem. Once again, this is Health Thyself with Dr. Mike on our new radio station, Community Radio, WBFY, 100.9 FM on your dial. Hello, this is Dr. Mike back again with you, and the discussion today is on the process of inflammation. And I feel that this is an important subject because if we can learn how to manage inflammation in our body, which is really something that's going to occur naturally for tissue repair and for other reasons, if we can learn how to manage it with proper foods and supplementation, then we can keep ourselves a lot healthier. And I think it's important for people to take responsibility for their health. I think the old paradigm with health is to kind of give over the responsibility of your health care to a practitioner. But I believe the new paradigm is to take that responsibility yourself, ultimately, which I believe it is, and to really watch and manage your own health, looking for the signs and symptoms of being out of balance, and knowing also when to ask for advice and consultation from a health practitioner. I think is very important as well, but we need to take charge of our health in order to stay healthy. So this process of inflammation, there's different causes that create inflammation in the body. Certainly one of them would be an injury, which we had talked about, whether it be a sprain or twisting a joint, or a cut, or some sort of insult to the body, which triggers this inflammatory response. But there are other reasons for inflammation as well. Infection certainly is a big one. A lot of times there's some confusion about the difference between infection and inflammation. But infection can cause inflammation, but inflammation by itself does not cause infection. And what an infection is some sort of either a bacteria or a virus or what we call critters, unhealthy critters entering the body. These could be parasites. More commonly, it's either virus or bacteria. And that kicks our immune system into action and triggers what we call the inflammatory response. So exposure to microbes, viruses, various things is going to happen. I mean, it's in our environment, surfaces. I mean, there's no way you can keep yourself totally sterile in terms of taking in different things. But it's important to keep your immune system healthy so that your body can respond to these different organisms and take care of them. And that's the job of your antibodies and your white blood cells. Stress can also have a big effect on inflammation. Stress is a big factor, particularly in our culture where, there's so much pressure often put on people's